Good evening, everyone. Are you all hearing me?
Good evening, I'm hearing you.
Okay. Dr. Hong, are you there?
Yes, I am. Good evening.
Dr. Hong, your mic is muted.
Yes, I can hear you. Good afternoon, everyone.
Yes, I was asking if you are ready to start or within the next five.
I'm ready. I'm ready.
Okay. All right, I'm going to ask everyone to please identify yourselves. So in logging in, just use your name. All right. Good evening again, everyone. I trust that you are all having a blessed evening during this lockdown. Thank you all for joining this week Meditation Mondays. Here every Mondays at 6 p.m. on all our social platforms. This week topic is COVID-19. Delta is here. Let's talk. We all know that COVID-19 changed our way of living, and with the new Delta variant present in Jamaica, what can we expect going forward? Please join another interesting and informational session with Dr. Mahong, regional epidemiologist with over 15 years of experience in epidemiology. Dr. Ang, over to you.
Introduction. All right, thank you so much again giving me this opportunity. I think we went through some details last week, and this week, the situation is very fluid and is changing rapidly. And after we spoke, and there was an announcement by the Minister of Health about the another variant, very dangerous one, Delta. It is here in Jamaica, so that has been announced. So today's topic is going to be on the new variant that we have identified. So we're going to talk a little bit about it, and we're going to entertain some questions, and I'm going to answer as much as I can. All right, so let's begin. All right, I'm going to start with the same question that I have started last week, Monday. I would like to ask participants, I'm not sure how many of us are on the platform, but I would like to ask, how many of us know or see or hear any celebrities in Jamaica or globally, any politicians, any public figures coming down with COVID-19, or how many of us know our neighbor where we live has coming down with the COVID-19, and how many of us know our friends and our co-workers and our relatives far and near coming down with COVID-19? How many of us know? And the answer is going to be all of us. All of us. I mean, being a doctor, I know of patients coming down with COVID-19. I know of some of my relatives near and far suffering from COVID-19 and so on. So the point is COVID-19, either Delta or not, it's here, and we all know everybody is being affected by it or infected by it. So this today's topics I'm going to be talking about, there are two focuses that we have. I'm going to be focusing on two things. One is where we are at with variants in terms of SARS-CoV-2 virus, and we're going to talk about vaccines and you. So where we are at with vaccination in this country, and also in our local community as well. All right, before I'm going to go to that, I'm going to show you a video which I think very relevant to us. So I'm going to be asking these persons to talk about COVID-19, the virus itself. So let's watch.
Viruses are very simple. They're basically just a shell of proteins surrounding some genetic material, either DNA or RNA. That genetic material is made up of molecules that can be represented as a series of letters, like this. Each part of this code contains instructions for how to make one specific protein that allows the virus to function. A virus has one goal: to make more of itself. But because it's so simple, it can't do that on its own. So it uses you. Every time a virus infects a person, it uses their cells to make copies of itself, replicating this complex code again and again and again. But eventually, it makes a mistake. Sometimes it deletes or adds a letter, sometimes it flips them around. That mistake is called a mutation, and it slightly changes the instructions for making the virus. That slightly altered virus is a variant. Since viruses are constantly going through this copying process, it's normal for them to change over time. For example, this chart shows some of the mutations the SARS-CoV-2 virus has made since December of 2019. Most of the time, these mutations are harmless, or even make the virus weaker, and they quietly disappear without making any notable difference. But other times, a series of mutations occur that give the virus a slight edge over us, which is what scientists started to notice with SARS-CoV-2 back in September of 2020.
You're seeing specific mutations that do allow the virus to bind human receptors better and enter cells better.
Coronaviruses are covered in spike proteins that they use to bind with and infect human cells. The thing is, that binding isn't a perfect fit, so it doesn't always get past the cell's defenses. But the B117 variant, which scientists later renamed the alpha variant, has multiple mutations on the spike protein. Mutations that make it easier for the virus to bind with cells, which can help make the virus more transmissible, which led it to become a dominant strain in many places around the world. But if SARS-CoV-2 has been mutating all along, why do the variants today, like this alpha variant, suddenly seem so much worse? It's important to remember that a virus doesn't make active decisions. It's not as if it creates a strategy within your cells. Mutations are random errors. But the longer a virus is around and the more people it infects, the more it will change. And the more those changes accumulate, the more chances the virus has to evolve into something more dangerous. These 4 variants, considered variants of concern by the World Health Organization, all have mutations on the spike protein. Delta, the most recent addition to this list, has been referred to as a double mutant, because while it has many different mutations, it has 2 significant ones we've seen before. This mutation seems to make the virus more transmissible, and a version of this one, found in 2 other variants, makes it easier for the virus to reinfect people who have already had COVID-19. Meaning these 2 mutations may have evolved to dodge our natural immune response. Fortunately, the immune response we get from vaccines is much stronger than our body's natural immune response. So, while we may see variants that make our vaccines somewhat less effective, most experts think it's unlikely one will emerge that completely evades our vaccines. But that doesn't mean it can't happen.
If you give the virus enough time and replicative cycles, it will sample a very large evolutionary space and find a solution to the problem we've presented it, which is vaccination and widespread immunity.
But even if SARS-CoV-2 doesn't get to that point, as long as the pandemic continues, and as long as the virus continues to spread, it will continue to make copies of itself. So, if we want to stop the variants, we need to stop the virus. The virus has evolved, but it hasn't morphed into something unrecognizable. The vaccines we have still protect against all the variants. The trouble is, we aren't getting those vaccines around the world fast enough, which is only giving the virus more time to change and ravage areas of the world that are still waiting. The rise of variants is a reminder that the pandemic isn't over, even if it feels like it is to some of us.
We need to stop this because we don't want a variant that affects immunity. And so that involves stopping replication everywhere.
All right, so I basically show you the how Delta virus has become a mutant and coming out of SARS-CoV-2, and basically that explains the how we end up having Delta virus. So you can see the four variants that they have shown you: Alpha, Beta, Gamma, and Delta. In Jamaica, we have Alpha, which is a most predominant one in globally, and we have it, and we have a COVID outbreak, and we have identified another one, which is Delta, recently announced by the Prime Minister of Health. So we now have two variants circulating in this country. So that in summary, basically, I just want to highlight the fact that virus, they do not move, but they move when we move. So that's the thing. So if we don't carry from one place to another persons are not going to be infected as long as we don't carry it from one point to another point. The virus is longer it stays, as shown in the video, and the more people are infected, there will be more variants. So we now have four variants of concerns, and we may have, or some of those variants could, but not will, could be more infectious than Delta. I'm not saying that it's going to be, but it could. We could have more. So as long as we have more persons are being infected, as long as the virus stay here with us for a long time, we're going to end up with the war situation. That's the point I'm trying to make. And finally, we talk about the virus will adapt based on how we move about our business and how the people are living, and they are quite well adapted in the situation. So it is for us to adapt as well. So when we talk about variant, the Delta variant, I'm going to give some details about what do we know about Delta variant so far. So these are the studies coming out of scientific communities around the globe, United States, and all over the world. Some papers are published by the peer-reviewed journals, and those are compiled as we identify these facts. One, since the Delta virus can go inside the cells more than based on the variant, based on their spike cells and the changes, it can easily go into. So that they have also an increased binding capabilities, so it can go into the human cell very easily, and is also multiplying very rapidly. So compare with Alpha, which we have experienced, we continue to experience, Delta virus has 1,000 times the viral loads as a number of the virus inside the body. It's more than 1,000 times higher than Alpha virus. And Delta virus has also capabilities of high transmissibility. If we talk about transmissibility, compared to Alpha and other previous variants, Delta virus is 64% more transmissible than other variants. So at the beginning of the outbreak, when we started to experience Alpha, the scientific community published the paper, and they have made aware of us that Alpha virus has once a person infected with Alpha virus, that persons can infect another 3 persons. So that is what we call reproduction rate, otherwise called R naught. And Alpha has 2 to 3 persons can infect. But for Delta now, based on the published papers and from the scientific communities and peer-reviewed journals, they are now saying that Delta virus can infect 5 to 9 persons. Now, that's a lot. So if you have a patient coming down with COVID-19 positive, and in public health, we do contact investigation. When we do contact investigation, when we find out who he or she came in contact with in the last 2 weeks, and during that alpha period, we're going to find maybe 2 to 3 persons or more than 5 persons. And when we test it, only 2 to 3 persons are going to be positive. For Delta virus now, it's going to be more than 2 to 3 persons. It's going to be 5 to 9 persons are going to be infected. So it goes to show the high transmissibility of the Delta virus. It's also, we have noted that Delta virus is more severe, as in 2.5 or almost 3 times higher than in terms of hospitalization. So a person's infected with alpha virus, even though the person may end up in the hospitals, but when it comes to Delta, it's more persons are going to be infected, coming down with more serious illness. So you end up going to have more persons are coming to the hospitals for hospitalization or needs a hospitalized treatment. In terms of prevalence, in prevalence, what we find is this is very interesting and it is very significant as well. What we found from the bottom is that less equal or less than 50 years and unvaccinated. So this is very important finding as well. Previously, even though we have identified in alpha, we found more persons over 60, 70, and 80, etc. But in delta now, we identify equal or less than 50. So the younger populations are being more infected with this virus. And also in United States and other countries, they talk about pandemic of epidemic or outbreak of unvaccinated. So most likely the persons who are now vaccinated are going to be infected, and the virus, Delta virus, is going to be very prevalent in that population and vaccinated, please note. And also either you are vaccinated or you're not vaccinated, 50 years and over with significant comorbidities. So 50 years and older with hypertension, diabetes, kidney disease, and so on, those cancers and other autoimmune diseases. So those persons are going to be infected with Delta virus as well. So that's what we call high prevalence, and particularly in those two age groups. And this is very important. And we also found that Delta virus presents slightly different from Alpha that we already knew. Mainly what they found is in Alpha, we noted loss of taste and loss of smell, very common. But in Delta virus, we don't see that much. So that's one of the significant finding as well. So you have 1, 2, 3, 4, 5 significant characteristics there. Viral loads, high transmissibility, higher than previous variants, but Delta virus can give you more serious form of COVID-19 illness, and it's also very prevalent in particular age group 550 and under, which is very significant. Even though you think you are strong and healthy, you can get infected and may end up in the serious form of COVID-19. And also significant finding, one of the significant findings is that they're slightly different from the previous variants in terms of clinical presentation. So on the right, you can see the chief medical officer have confirmed the Delta virus in the country. And what you can see there is Westmoreland. Westmoreland is one of the parishes in the Western Regional Authority, and Westmoreland have identified Delta virus as well. So this is very closer to our homes. Now, this slide I show you in the last week's presentation. So this is what we call reproductive number, so RO, R naught. And compared to alpha, what is known about alpha, and now we know about delta. So alpha variant, one person can infect 3% within 7 days, and 3% can infect 9% another 7 days. 9% can infect another 27% another 7 days. 27% infect another 81% in 7 days. So we can see at the end of 1 month period, one infected person can infect 81 persons. If we are to look at the higher, the upper bound of R naught for Delta, 5 to 9, if we look at 9, 1% can infect 9%. And if my calculation is not wrong, what we are going to end up is 1% can infect almost 7,000 persons within a month. So let's look at our data in local situation. So we talk about seriousness of Delta and transmissibility and so on. And that is supported by what we are seeing now. By the way, Delta virus identified in Jamaica was announced last week as August 18 or 19, I believe. But the date of onset for that samples sent to the other CARPHA, Caribbean Public Health Agency, was July. So July or maybe before July, a little before July, we have already established Delta variants in this country. So let's look at the data now. So you can see on the top figure, the bar chart indicates the daily positive cases of COVID-19 in Western region. In this case, this is Westmoreland. I believe this is Westmoreland. So first wave that we have experienced sometimes in November to October or September, October 2020. You can see right there. And second wave came in March 2021. So you can see second wave numbers is higher than first wave. And now we are looking at third wave. So we started to see increased number of COVID-19 positive cases in July 2021. And numbers are very explosive. And first wave, second wave, and third wave, we have identified more persons. So we are talking about reproductive number ratio, whatever you may want to call it. And we're talking about 5 to 9%. That may be true here because of a lot of persons are being infected. So that's what it shows in third wave in Western region right now. And we talk about the severity of the Delta virus, and Delta virus push you more persons going to be hospitalized. And you can see the line graph in the bottom. This is Savalama Public General Hospital bed occupancy. We look at and we collect data daily, and you can see starting from last year and started to increase. And when you look at July right here, 2021, you can see the increased bed occupancy. Over here is percentage of bed occupancy. We are talking about more than 250. In other words, if you have 2 beds for COVID-19 patients, we have like 10 patients with COVID-19 to be admitted. That's what it means. So more persons are waiting to be admitted, but we don't have enough bed to accommodate them. So that's where we're talking about more than 100% bed occupancy. So these 2 graphs just to show you the significance of COVID-19, Delta virus in particular. Now that we have established that the virus is here, and this data also support that it is here. So what can we do about it? Now, this one, everybody knows, these are non-pharmaceutical intervention, and we know that it is working very well based on the past experience with first wave and second wave. And they are ranked in order of their effectiveness. So when you see number 1, gathering restrictions, if you gather restriction, like I said, virus doesn't move. When you move, virus move with it if you are infected with the virus. So when you restrict the gathering, or if you congregation, you don't go around a lot of persons together in one place. In that case, we can actually bring down the numbers of positive or number of infected people. And also, I'm not going to go into detail, but you can see right there up to 10 of them. Curfew, specific geographical restriction, border closure, physical distancing, and so on. And this is what show the restriction of movement and intervention, public intervention works. So I just want to show you this line here. This is the line 1. This is reproductive period. Reproductive number. So one person can infect another person. That's the aim that we would like to achieve, on maybe less than 1%. So starting from last year, what we do, these words are explaining what type of intervention that we did. For instance, reopening of the border, restriction of the border, closure of places of amusements, and so on. So when we have started with a little over 1.2 are not. So 1% can infect 2% at that time. Excuse me. So we put intervention, public intervention. You can see the number goes all the way down here, and the 1, which is where we want them to be. But as soon as there is some sort of opening of the border and other things come along, and that are not going up again. In some instances, going all the way up to 1.6, so almost 2 or 3. So at that time, we did public intervention. It's going down again, and for some reason, when we have like public holidays and other activities going around at a particular time, that are not going up again. So we put another public health measures, and it goes down again. So using that principle, and you can see we now have a 7 days no movement 7 days. So that is being implemented to see similar effect of bringing down the numbers. All right. So another important aspect of the bringing down the number is vaccine. Now, someone infected with COVID-19, these are the outcomes of it's going to be. Starting from your right, we would like to establish that we have no infection in the population. But once someone got infected with COVID-19, the person may going to show no sign or symptoms. From there, it's going to go to moderate symptoms. And from there, it can go up to severe and hospitalized. And some of those infected person, unfortunately, may end up dead. So these are the outcomes of someone who became infected with COVID-19. So what vaccine is going to be doing is to prevent that, But we would like to achieve that no infection due to vaccine. But vaccine is not, in reality, vaccine is not doing that. What vaccine is going to be doing is to make sure that even though you are going to be infected with variant, whichever variants that you're exposed to, and you may have a little bit of sinus symptoms or no sinus symptoms, and you may end up moderate to severe. But vaccine is going to prevent you from moving from here to here. So you may end up with some moderate symptoms. So a little cough and cold, shortness of breath, and so on. After that, you're not going to end up having severe sinus symptoms or hospitalized. So we would like to prevent, or vaccine is going to prevent that. That's what vaccine is going to be doing, and also prevent deaths. So that principle is supported by this phase 3 trial of the vaccine. And during phase 3 trial, there are two different types of groups that we looked at. One is we're going to have two groups. One group is giving placebo as in, nothing at all. Just give some sort of water or something to that. And another group is going to be given vaccine and try to see what are the outcomes. So when we compare those two groups, what we found is in placebo groups, which did not receive vaccine, they have persons who are being hospitalized, they have someone who died or persons who die in this group. But when we look at the vaccinated group, we have no deaths reported from that groups, and we have no hospitalization reported from that groups from this clinical trial or phase 3 trial. Now, we have vaccine available in this country. We have now three vaccines are now available, and one after another. And people may want to wait for another vaccine based on vaccine efficacy and so on. People talk about it, and that's another topic that we can discuss later. But based on the efficacy, people heard about this vaccine is better than the other, so we're going to wait for that vaccine. No, the important point is the public health specialist on advising that what vaccine is best for you is that what is available to you right now, because all vaccine will do the same. And I just showed you previously, we have all vaccines are going to prevent persons who have been vaccinated with any vaccine. They will prevent you from severe symptoms, and they will prevent you from hospitalized in the hospitals, and they prevent you from dying from the COVID-19. So what is available to you, Pfizer, AstraZeneca, or Johnson & Johnson, whatever it is available to you, you need to get it now. And we are saying that every time we inject or inoculate one person with vaccine, we are getting closer and closer to go back to our normal lives. And last week, I briefly spoke about this as well, why people do not take vaccine, and 5 C's. I'm going to just repeat briefly again. So one is confidence. So the person trusts in the vaccine efficacy and safety. So vaccine efficacy and safety, there are many different published papers out there, and there are many comparison with one vaccine to another. But the common findings is that vaccine cannot be compared to, one vaccine cannot be compared to another vaccine for many reasons. Sometimes what time they have done their clinical trials, phase 3 that we're talking about, and which population that they have trialed, and also what variants are prevalent at that point in time. So that's why one vaccine cannot be compared to another vaccine in terms of efficacy. But all vaccine will do its job to prevent from you hospitalization and serious form of COVID-19. Also health services, a person stress on health services offering them, and policymaker deciding on their rollout. So if you're working with the Ministry of Health and Wellness in Jamaica, if you yourself or if we yourself do not believe in Ministry of Health and Wellness, those people will not take the vaccine. And also policymakers, uh, uh, I don't want to go into detail for that, but policymakers, if we don't like the persons who making the decision, those persons may not take the vaccine as well. Complacency is very important. So some of us still of believe that we are not susceptible. We're not going to get it. We are not at risk of getting COVID-19. But when you happen to be in the hospital setting, and when you are in the health facility setting, I'm talking about 200% bed occupancy and so on. The place is crowded with so many sick people. And when you are sick, COVID or not, when you ended up in the hospitals, you're going to experience how hard it is to get to be seen by the doctor, how hard it is to get a bed to lie down. You're already sick and you're so tired, and there's no bed space for you. So our hospitals are now being overwhelmed, not only in Western Jamaica, it's all over the country. Calculation. That is where you go onto the net, your WhatsApp group, your internet, your Facebook, and so on. So that's where you try to look at some information and you try to weigh up the costs and benefits. What if I don't take vaccine now? What if I'm going to end up having COVID-19 tomorrow and I'm going to be sick and I'm going to end up in the hospitals? Who is going to look after my children? Who is going to look after my brother, my sister? Who is going to look after my baby mothers, baby fathers, or husband and wife? That sort of calculation that we have to. So based on the information available, and we also call infodemic, there are so many informations out there, and you have to balance what is the best for your interest, and also us, medical professional, as to what is the correct information. Constraints are convenience. Previously, I have to tell you, though, some parts of the world, people are dying to get vaccine. There are those who are being shot at and killed, and there are those who have to buy vaccine in the black market to have vaccine. It's not very accessible, and for those who are a little bit over the fence, and if vaccine is not easily available to them, they're not going to take it. It's some sort of convenience. And the last thing is very important, and I emphasized that at my last presentation: collective responsibility, the willingness to protect others from infection through one's own vaccination. So taking the vaccine for you, it's not only for you to protect you or yourself, it's also to protect others around you and others, in this case, family members, or in this case, colleagues, in this case, community, or by and large, for the country. So collective responsibilities. It's not only that you who take the vaccine is going to protect you, it's protect the whole community and country. So this morning, I saw the press from Nationwide that we have 115,000 doses of Johnson & Johnson to arrive tonight. So in terms of accessibility, we don't have any issues here. And also Minister Johnson Smith, the foreign minister, is also confirming that approximately 200,000 Oxford AstraZeneca vaccines are expected to arrive later this week in Jamaica. So we're talking about this week. And we're going to have two different types of vaccines are going to be arriving this week. One is now, and the other one is down the line in this week. So access or availability is not going to be an issue. And we also have previously, we have donation received from United Kingdom, donation received from United States in terms of Pfizer vaccine, which we have already used over the weekend. Now, this is also in the news this morning from CNN, from United States. Federal Drug Agency, FDA, grants full approval to Pfizer biotech COVID-19 vaccine. And it's the headline say opening door to move vaccine mandates. So FDA is now approved the full approval. So Pfizer and other vaccine, other two vaccine are approved for emergency use by WHO and FDA. Now that they have approved, starting with Pfizer, and when you have a full approval, just like what we have for measles and other vaccine that we have we inoculated at the beginning of our lives, and once it's approved, and it might go into the mandatory vaccination in United States. I mean, we're not talking about here as yet, you know, we're talking about over there. So that's another update, another steps that are going towards fighting COVID-19. So we're going to look at other data from the Western region. So on your left, in the top bar chart, that's an age distribution of test positive cases. So persons coming to you, some of them come with sinus symptoms of COVID-19 or respiratory infection. There are those who are coming with other complaints, and we have tested, although we also test those who are close contact of confirmed cases. And this data is from yesterday. We have positive cases identified. You can see the age band. This is what I'm trying to show. I wanted to show to you. It's 20 to 29 compared to other age groups. 20 to 29. 20 to 29 is very young, you know, relatively young compared to other age groups, and they are the most feature in positive cases from our testing results yesterday. And we also noted 10 to 19. So basically, I'm saying, you know, younger age groups are showing up with sinus symptoms and now becoming positive. So that's another feature of Delta that we just previously mentioned. Now coming across to the bottom here, oops. This is the age breakdown of severely and critically ill. So severely and critically ill, as described in the word severely and critically ill. These are patients who need hospitalized and specialized care. And some of them going to need other assistant ventilation and so on, you know. So what we
we're going.
someone mic is on. All right. So when we look at the age breakdown of those persons severely and critically ill, we're not talking about someone with, you know, minor symptoms or moderately ill. These persons need hospitalization and additional specialized treatment and care. And when you look at the age, you see 50 to 59 feature the most in this age in this graph, and we also see 30 to 39, 40 to 49. So those are supposed to be healthy and strong enough to fight, you know, virus. But in this case now, since Delta is here, we can you know, theorize that this can be due to Delta, and we can see the younger age groups are now being affected and end up in a hospital with severely and critically ill. By the way, these persons are the data coming from hospitals. So these persons are already in the hospitals. So these two show you the younger age groups are being affected. Younger age groups are now being hospitalized. So this is you know, very concerning for us as well. And these are the one who is going to be working out there in the bank, you know, any commercial activities and other productive sector of the government. So those are now being ended up in the hospitals and sick. And when we also look at the numbers, this is in the box, which is very important. And I just want you to pay attention to it. You know, I've been following closely to this data. Those admitted with critically or severely ill, we're talking about critical and severely ill, very ill people, 98 to 100% are documented as unvaccinated. And I said that at the beginning of the presentation, in United States, they talk about, you know, when they have looked at the states where low vaccination coverage, that's where most persons are being, hospitalization rate is very high. So similarly over here, we are seeing a piece of information from our own, and 98 to 100% are unvaccinated. They are ended up in the critically and severely ill, and all other admitted. So there are those who are mildly ill, but they have other comorbid conditions and they have other illnesses that need to be hospitalized. And those asymptomatic persons, those mildly ill persons, moderately ill persons, when we look at them, 95 to 98% are also unvaccinated. So we are talking about persons who are unvaccinated. We are talking about young people. We are talking about younger age group. They are having serious issues or serious problems or seriously affected by this COVID-19. And this is the vaccination status of me. And I am fully vaccinated. When you look at all the way down, and there's a stamp saying fully vaccinated. So, you know, I preach and I encourage others to take vaccine, and I myself take the vaccine, and I have not have any issues post-vaccine. And I'm very well right now, and I can speak to you about COVID-19. So I'm just saying that there may be some side effect, pain in the shoulder and a little fever and so on, but there's no serious side effect, and I am here to tell you that I'm okay. And that's the end of my presentation for the day. Thank you so much for listening, everyone. Over.
Yes, Dr. Hang, thank you for another informative presentation. I trust that it was well received and everyone is now in the know. I want to thank you all for joining this week's program.
Are we going to?
Any questions?
Yes. Dr. Ong,
Go ahead.
I have a question. So, are you hearing me?
Yes, go ahead. I'm listening to you.
Okay, was it last week? When was the 18th? When the minister announced that the Delta variant is here, and we sent out that message, that press release to everyone. I remember there are some staff who reached out to me quite anxious, stating that they were unsure as to why they went ahead and got the vaccine to begin with, because based on the minister's message, they listened keenly, where the minister indicated that vaccinated persons are still able to get the virus, and they're still able to transmit the virus. And I believe that this is a question on a lot of persons' minds, especially persons who are hesitant to take the vaccine, to say that if they are still able to get the virus, and if they're still able to transmit the virus to others, then why is it then that it is being perpetrated as if unvaccinated persons are the problem or the reason for the spread? What do you have to say in response to that?
Very good question. Very good question. I think I touched a little bit on it, but I did not say it fully during the presentation. So I'm sharing the screen again for this particular slide. So vaccine, the objective of the vaccine is not to prevent you from getting infection. So you can still get infection even after the vaccination, because vaccine has no 100% efficacy. There's no medicine has 100% efficacy. So there's going to be some of those who are going to be infected, and based on the work that you are doing, for instance, for the doctors, for instance, they are being exposed to the patients constantly, right? So it's very difficult for them not to be infected with COVID-19 or virus or any other bacteria or anything that surround in the hospitals. So they have to use the personal protective equipment, and they have to be mindful about whatever they are doing the procedure on the patient. And they have to be mindful about infection prevention and control practices. So that is well established before the COVID, because we are working in the infectious population. So even though you are vaccinated, vaccine is not going to prevent you from not to get infected. But what vaccine is going to prevent you from is going into serious form of COVID-19 illness. So I'm talking about serious, as in you're going to have a pneumonia, you're going to have a serious shortness of breath, and you can breathe, and you're going to need oxygen. And in some instances, you have to be given like a ventilator or some sort of specialized treatment to recover from COVID. And some may not be fortunate enough to stand the serious illness. So some person may going to end up dead. Vaccine is going to prevent just that. So you're going to be infected, whatever reasons that you're going to have, but you may be well enough to fight it and not end up in the hospitals. So that is something that we're trying to prevent. Right now, our hospitals are filled with COVID patients. And as you can see from the last slide, almost all are not have not yet vaccinated, and those persons are ended up in the yellow things I highlighted over here, serious symptoms, and they need to be hospitalized. If we do not quickly vaccinate those individuals and the rest of the population, and we're going to have more persons who are being infected and ended up not with the mild symptoms, it's going to be ended up with a serious form of illness, and they're going to end up in the hospitals, and hospital has no beds for them because we are the place is overwhelmed. Okay, so in summary, vaccine is going to prevent you from serious illness and hospitalization. And all the vaccine which are available to us are doing just that, all of them. Did I answer your question?
I believe so, but it opened up another question in my mind. So what about persons who believe that they live healthily, they eat right, they have a particular standard of health health code that they live by. So in other words, they eat all the right foods, they eat alkaline and all of that, and they believe that their immune system are very strong. And so this the um they're getting seriously ill that does not apply to them, and so they do not need to take the vaccine.
Yeah, that's normal. That's normal. I think I said that in my 5 C's. Susceptibility. Susceptibility is how do you just conceive yourself? Are you susceptible or you're not susceptible? So people may think that, oh, I eat right, I'm healthy, I'm only 49 or 35, I'm strong, I'm run, all of that, and I'm not going to get COVID-19. But what we are saying is the transmissibility of this virus. And I tell you, one patient, one infected person can infect 5% or 9%. And this is very, these days, especially with Delta virus, we have the virus can easily transmit from one person to another. No matter how hard you try to protect yourself, sometimes you may miss the opportunity and you're going to be infected. And also, what if I should have mentioned to you that we are in the stage of community transmission. Community transmission, as in simply put, so if you have a person who is infected with COVID-19, so we do the contact tracing. So let's say I'm infected with COVID-19. Public health comes and ask me a question as to where you were in the last 2 weeks. You may be exposed to someone in the hospitals, you may be exposed to someone in the office, you may be exposed to someone over there. I'm telling them now that over the last 2 weeks, I never gone anywhere. I'm stay home at home. I have only my wife and my child and children come to my house. That's it. And I have little helper coming to my house once a week. That's it. And they are healthy. They don't have any COVID-19. So in other words, we are not able to identify the trace or source of infection. That's what we call community transmission. When community transmission takes place, we consider everyone around you is positive. So if you think you're healthy and you're trying to stay in the restaurant, for instance, and the person next door, even though he or she may be healthy, but he or she may try the discharge virus to you on the desk, and you touch it, and you unknowingly touch your face and your mouth at some point, and you're going to catch it. So virus is everywhere. Infected persons are everywhere. So that's where we got pandemic. That's why we got community transmission. The important point is, even though you may catch it, fine. You're going to end up with mild or moderate symptoms. You're not going to end up in the hospitals. Without vaccine, based on all evidence are indicated to the direction. Without vaccine, more persons are going to be infected. Without vaccine, more persons are going to be infected. Without vaccine, most of those persons are going to be end up in the hospitals. With vaccine, even though we have more persons are infected, only small amount of populations are going to be ended up in the hospitals because they have very serious comorbid conditions and so on. So that's what we're trying to achieve. Because once we are overwhelmed with COVID patients, And we're talking about other diseases, sometimes who may have heart conditions and myocardial, that heart attack. If the person goes there, yes, the person is going to be get through, but the crowd that you are going to be see over there, and the doctors and nurses and whoever works there, they are also overwhelmed, they are tired, and they are frustrated and all of that. So that's going to impact the treatment that you're going to get if you end up in the hospitals. So vaccination is just going to be doing just that. And if you think you are not going to get it, you may want to think again, because we are in a community transmission and virus are everywhere. And also this virus, the Delta one, the variant is more in terms of transmission, they are more easily transmitted from one person to another. But another point I make at the beginning is that if we are not, if we continue to maintain the virus in our population for quite some time, if we continue to maintain more infected persons in our population, the virus is going to change to another form, That's what happened in the United States, that United Kingdom, that's what happened in India. That's how that new variant comes about. So if we are maintaining the virus in our population for such a long time, and we have so many infected persons, virus can stay longer in our population and it can multiply, mutate, and we're going to have another one. And we don't know that another one is going to be more serious than the one that we are seeing right now. Okay.
Okay. Just to let you know, I have joined the meeting with my entire family. So one question coming from a member of my family is, what is the what are the symptoms of this new variant?
The symptoms is similar to what we see with the alpha previous one. We still have alpha with us. So you're going to have respiratory illness. So respiratory illness, I say you're going to have a little. You're going to have fever. Mostly, you're going to have fever, respiratory symptoms such as cough and cold, sore throat, and the sneezing and so on. And also with alpha, we have loss of taste and loss of smell. That's very common. And you may also have some sort of gastrointestinal symptoms. So you have a little bit diarrhea or running belly and so on, and vomiting. But for Delta, no. Delta also have similar signs and symptoms as alpha, but the only difference that we have identified so far is loss of taste and loss of smell. Delta virus does not produce that. So that's the only significant findings that we are seeing so far. Okay, so mainly this is a respiratory type of illness. So you're going to have respiratory illness, sneezing, coughing, headache, the sore throat. Those are the commonest signs and symptoms. Fever is the most common. Your fever at this point, proven otherwise, you can be considered COVID positive, COVID patient, COVID infected. Another family member want to ask something? it's okay, it's okay. It's okay. This is the opportunity.
So suppose, I'm sorry, before I ask another question, I don't want to dominate the session. Does anybody else have any questions? Okay. So suppose one is feeling having fever, a cough, and so forth. Should one just go to the hospital or the health center, or what should one do when feeling? And I'm not talking about serious symptoms, just maybe just feeling a fever and a cough and a cold. Does that mean that you should go right ahead and get tested immediately?
Well, someone who is sick, I don't want anybody to stay home when the person, he or she is sick. So first thing you would like to do is you would like to get in touch with someone from the health center nearest to you, maybe a doctor or a nurse. Let's say if you live in, let's say Flankers. In Flankers, there's a health center in Flanker. So it is very important this time to know the number of those health centers, and you may want to call them and try to consult with whoever is available. And we also have, as you know, in Western region, we have an emergency operating center in all 4 parishes. So you may want to call them, and based on the discussion that you have, the person will advise as to whether or not you should come or you should go to that particular location for further clarity or further help. So there's no right or I mean, definitely answer that I cannot give you over the phone. But if you are ill, you shouldn't be waiting at home, sitting and watching for it. You have to try to get in touch with someone. You don't want to go to the hospital right away, but you may want to call someone near to you. Maybe private doctors, if you have known any private doctors, if you know someone from the health centers near to you, you may want to call them and consult and see what the advice is going to be. But definitely you don't want to go to the crowd. I mean, if you are sick, don't go to Charles Gordon Market. That's the advice that I can give you. Not to the Mega Mart or anywhere if you have a respiratory illness.
Dr. Ong,
Yes.
my question is, suppose you know of somebody that you've been in contact with and you hear that they have the virus, but you are not showing any symptoms or anything. Do you think you will be panicking if you go and get yourself tested?
No. You don't need to panic. I'm just saying to you that we are in the community transmission phase. So we are now considering everyone is COVID positive. So the persons who have signs and symptoms, now they have COVID positive. And what you need to find out is that the person, you're going to end up being tested, not before being tested. You will be receive a call or calls from the health department as part of the contact tracing, and they're going to interview you as to whether or not you need to be tested right away, or you need to be given appointment to be tested, or you need to come to the hospital right away based on the interaction that you may have with the persons on the other line. And based on the instruction that you get, you're going to be directed as to what you should do. I don't want to, and that's my personal advice, is that once that happens, I don't want you to go to the location and start testing it. The thing is, that may be another way why we are having so many positives these days. Persons are panicking and persons go to the area and not necessarily following the infection prevention and control procedure during the waiting time, going about their business and taxis and so on. From there, the infection can spread to other persons, or you can get infection from other persons as well. So long and short of it, that advice is trying to get in touch with someone from the health center or from the EOCs of health department before you end up going to the hospitals. But you are seriously ill, I mean, you don't going to wait, you just go to the hospitals.
Thank you.
Any further questions? Okay. Once more, I want to thank you, Dr. Hong, for a very informative presentation. Thank you all for joining this week's program. Do have a good evening and keep safe.
Before you go, I just want to summarize what I just said. The objective of this presentation is going to be, I just want to convince everyone that vaccines are available very easily to you, and that vaccines, based on the studies and based on the scientific community's recommendation, and we all know that vaccine protect and save lives, and vaccine is going to protect you from getting serious illness. So using the opportunity and take the vaccine if you have not done so, because when you look around globally, not the rich countries, Jamaica is very blessed. This country is very blessed. If you look for other countries around the globe, especially Asia and other countries, they are waiting to get vaccine, and they don't have vaccine. They have to buy vaccine in the blood market to get that vaccine. That sort of things. And we are here. Vaccines are easily available. So take the opportunity and protect yourself. By doing so, you protect the family, you protect Western Regional Authority, you protect the colleagues in your workplace, and you also protect the nation. And we can go back to the normal lives as soon as possible. That's the aim.
Dr. Wang, I have a question.
Why?
The Pfizer, they said that it's no FDA approved, right?
Right.
It's here on the island, and it's for children between the ages 12 to 18. So is it a case where no adults is allowed to take it?
No. The target is for children, and the obvious reason is, September next month, I think the schools are going to be reopening, and that's the aim that the government of Jamaica has. And they want to achieve that, but they want to give they want to protect the children. So the target is to get those children who are going back to school to get Pfizer vaccine, because that's the only vaccine approved for children. But if you go there with your child or children to get Pfizer vaccine for your children and child, and if you want to have it, if you have not yet received the vaccine, yeah, you're going to have it. I don't think the sites are turning away for those who are coming for vaccine, either Pfizer or AstraZeneca. But we have a target. Let's say we're going to have 5 children going to be vaccinated. And I just started vaccinating 1 child. And you come and ask for it. I'm going to ask you not to go away, but I'm going to ask you to wait until those 4 children are vaccinated. If I have additional vaccine or Pfizer, I will give you. Otherwise, you're going to get another vaccine, which is AstraZeneca.
Oh, okay. Thank you.
Good night, Dr. Ong.
Yes, sir. Mr. Perry.
I have a few questions. All right. If you catch a virus, right? COVID. How soon after you're cleared, do you have some kind of immunity, or can you get infected immediately after?
That's one.
Mm-hmm.
Right. So just like any other infection, virus, in this case, once you are infected with virus, so first things comes off is antigen. Antigen is going to fight the virus, and now antigen start fighting, and also the body produce the following after antigen come out from the body, antibody also coming out. Antibodies also coming out. So that antibody is going to be in your body, and for this particular virus, we're not quite sure how long the antibody is going to be stay in the body. That is still being studied, and some say that it's months, some say that it can be like only 6 weeks, and so on. So that's why even though after you've been exposed to COVID-19, and we still recommend that you take vaccine. That's the only reason why. Yeah, that's why, because we don't know how long the antibody stays in your body. So
okay.
Right. So virus comes back again, you're going to catch it again, and you're going to be infected. And also remember, Mr. Perry, we are talking about not only one variant, We're talking about, I talk about 4 variants that I mentioned previously.
Okay, so you're saying that the antibodies for the first variant might not do anything for the new variant, it's to get a new one.
Not only that antibodies for the same variant don't know how long it stay in the body to fight against the same variant. Right.
I see. So you're saying it's recommended even after one would have catch the virus and recover, that they still take a vaccine?
Correct.
All right, so how soon after one get infected should one take the vaccine?
I will go back and check. I think it's almost, I don't quote me. I don't remember exactly. I think it's too, so I'll tell you later. I'm going to check it.
Okay, so you're saying that, so after that 14-day period, then there's a period that needs to elapse before you can take the vaccine, right?
Right, correct.
All right, but you're saying that you're not sure of that time period just yet. You don't want to misinform me.
Yeah, man. I'm going to give you shortly. If you have a next question.
All right, another question from my wife. She's saying that, say for instance, you took your first shot and you happen to get infected during the 6-week period, 8-week period. It's 8 or 6. Hello?
Yeah, man. Can you
Yeah,
drop
man.
her
So
to
she's
speak?
saying that if you get infected between the first and second shot, do you then have to restart once you heal?
No, the vaccine, she can take the vaccine, second dose, but it has to be the period that we just spoke about. So you have to be
Leave some time between.
yes, yeah, between that first
Okay.
infected period and second time to
And the second shot.
yes.
Okay, clear. I see. All right, thanks.
Dr. Ong, there's a concern here on my side from my family member about reports of blood clots after taking the vaccine.
Yes. What about it? Concerned about the blood clot
Yes.
after the vaccine? Yes. That's also a very concern for all of us because any vaccine can give you the or any medicine, I would say, any medicine can give you side effects. And the blood clot documented in some countries, not here in Jamaica though. Some countries documented that that's one of the side effects that they have noted. But we are talking about millions of persons who are being vaccinated against, and we have numbers. I don't have an exact number here. Numbers compared to millions ended up with some sort of the side effects. So we are balancing benefits and side effects. So if you have, let's say, 1 million vaccinated and or 2% ended up with blood clot, are you going to disregard the vaccine because 2% got side effects? In this case, no. We're going to continue with it because we can protect another, almost 1 million ended up from dying or getting serious illness. You follow what I'm saying? So, like I said, even paracetamol, when you take paracetamol can give you the shortness of breath and rash, and some people dying from paracetamol poisoning. That's a daily medicine that we've been taking. Just like any medicine, vaccine has its side effects. And before we produce or before we give the vaccine, you notice we ask for particular questions. We ask medical history. We ask any allergic conditions and so on. All of these things are what we call screen. And after screening, we give injection. We give vaccine.
Dr. Ong.
Yes, sir.
Another question. So just one thing I want to be clear on, because I mean, just like other information is going on around here, I don't know what is true, what is not. I heard that when you're infected, after say 10 days, you're no longer able to transmit. Is that true? I mean, if you had a virus for a 10-day period, after 10 days, you won't be able to transmit to anybody. Is that so?
Well, at the beginning of the what we call onset of symptoms. So as soon as you start showing signs and symptoms, within I show you 7 days period, but the date can be 7 to 14 days or 7 to 10 days. Within that period, you're very infectious. You're very infectious. In other words, a lot of virus are in your throat, a lot of virus are in your mouth. So you can easily infect, sneeze or talk or shout, or that's where you can easily infect to other persons. So what we call infectious period. After that, it doesn't mean that you don't have any viruses, but you have the viruses inside your respiratory systems are very, very low. So it's not going to come out just like what you used to be within the 7 to 10 days. So it's still can infect, but I mean that possibility is going to be
it's harder.
Very low, yes.
Okay, so as far as that this 14-day period that you're given to write it out, it is quite clear that after 14 days you're more likely clear. Your immune system would have done what it needs to do, and you'd have been you're declared cleared, right?
Repeat it again, Mr. Perry.
No, I'm just saying the 14-day period that is being spoken of.
Right.
It is proven that after that period and you have no symptoms, You mean that your immune system would have done its job?
Yes, correct.
Okay, cool. All right, thanks.
Any further questions? Okay. So the program will end now.
I thank you everyone for joining. Thank you very much, Dr. Ong, once more. Really appreciate you facilitating the discussions and the questions. And thank you very much, Ms. Gordon, for setting up this program. Really appreciate it.
All right, before we go, Mr. Perry, I just want to answer the question. So after, based on what I'm seeing is 14 days. 14 days after you clear of infection, you can take the vaccine.
14 days.
All right, thanks, Doc.
Okay, all right. Thank you, guys. Good night.
All right, have a wonderful night, everyone.
Thank you once more. Have a good one.